Hi, I'm Dr. Adriana Potter, and on the video today we're going to talk about a little bit balance and shoe support so you can actually make a good decision about what kind of shoes you should be buying. In general, if you have a very flexible foot, which means that there's a lot of mobility into your joints, you want to get a shoe that is a little bit stiffer. And if your foot is too stiff, there's not a lot of mobility, one, you want to stretch, but the other one, you don't want to get a shoe that does not move, does not kind of have a lot of pliability to help your foot to move a little bit more. Okay, I'm going to talk about a couple things for you to understand how to select a good shoe. In general, if you're going to be walking, you want to find a shoe, it doesn't really matter which brand it is, that doesn't fold all the way. You know, some shoes you're going to be going and they might be folding all the way, or like whenever you press them they would just kind of go flat like a pancake, and those shoes are the flexible kinds, and you're gonna try to stay away if you're having a lot of mobility in your shoe. Okay, so that's the number one. You don't want to be flattening them like a pancake, you know, like a sandwich when you try to bend them. The second thing you want to look for on the shoe is actually how much flexibility there is. Some of them you'll be able to twist a lot, and so if you want a shoe that is a little bit stiffer, that's going to give you a little bit more stability, you want to make sure there's not a lot of twisting happening on the shoe. As well, a keel support, which is how much firmness is, and you can find like this one, it has a little give into the heel, and this one is a Brooks. Actually, it does not have as much as that, you know, give in here. It's very firm, very stiff on the back of the heel. So if your ankles are very flexible and you tends to roll a lot, this is the kind of shoe you want to look for, the one that does not squeeze it, squish it as much. Okay, so that is the type of shoe. Also, whenever you are doing it, I always tell my patients, trying to do a balance exercise without your shoe, and then put your shoe, the selected shoe on, and then redo your balance exercise. That way, if you find that it's easier for you to do the exercise, or your motion of the balance that you're actually doing is better, you don't have to do a lot of work, that shoe is giving you more stability. Okay, so that's one of the things that I do. And by that I mean, so just keep watching on the monitor. So when you're doing a balance exercise, you're gonna look for a couple things, okay? Keep watching the monitor. I'm gonna stand up so you can see what my foot is doing, okay? So you start with the balance in one leg and see how stable it is. You might be like you're wobbling all over, or your toes are gripping very hard, and you're kind of just working really hard just to balance them there. If that's not very challenging, you can start a little bit motion into your balance on the back and forth, so you can get a little bit of that frontal plane, and you can also do a little bit at the hip abduction and see how much work that bottom foot that is standing is doing it. And the most difficult one is actually a little bit the rotation of the transverse plane, and you're trying to find out how much of the movement is happening. And then how you test it? Well, you're gonna put your shoes on, okay? And I'm gonna put my inserts back in here. And you're gonna do the same exercise with your shoes on. And you're gonna assess that mobility. If you're not sure how much of that stability that shoe is actually giving it to you, you can always buy it, bring it to your physical therapist, and have them look at for you, because they have a very trained eye to assess a little bit of that ability to perform an exercise with more ease or less ease. So we are very trained on that point to analyze the movement and see if the performance is improved or not with your selected shoe. Okay, so I'm going to repeat the same exercise that I just did it on bare feet. Now I have my shoe on. Okay, so let's see what happens. So my first, it was just standing on it, and it looks pretty stable at that point. It's not wobbling it. And then I'm looking for that frontal plane. I don't feel a lot of work in either. And then I'm doing a little bit of that sagittal plane. Alrighty, seems to be very good. And then I'm doing a little bit of that transverse plane. So I feel like it gave me a lot more stability, and there was very little wobbleness into my leg with adding of the shoe. So a little thing that I want to talk about, it maybe is a little bit the longevity of your shoes. I have heard that you know, different informations about how many miles you have in your shoes, and if you're an avid exerciser, you probably know how long your shoe will last, and how many miles will last if you run or walk a lot. But if you don't, it's kind of hard to keep track about how old is your shoe and when should you switch it. One, you can reassess those stabilities that the shoe had it, and if that's starting to fail or losing a little bit of support. That's one way, and you kind of checking with your balance, how much of your balance is same, better, or worse when you have the shoes on. The second thing that you're gonna look for is actually the amount of wrinkles that you have in here. So the amount of wrinkles, it will tell you how much absorption the shoe have lost. The more wrinkles you have, the less absorption it has, and you're gonna feel more over your joints. But that will vary a lot from how much you wear your shoes and how much you stand on it, and the age of the shoe, because the material will also age and lose its ability to perform the absorption, okay? Actually, this is a Brooks and this is an Asics, and this is actually a lot older. However, it still provides quite a lot of support. The wrinkles are there, but I feel like it still have quite a lot of cushion. The only thing probably with the shoe is that it is wearing out, so it's kind of doesn't look pretty as much, and it's starting to have some holes in it, so it's more the static of the shoe in this case that is losing the support, and the look versus it is the support. One thing we also looking for is the wear and tear on the bottom of the shoe. We also looking for how are you wearing. Are you wearing your shoe more towards this edge or towards the other edge? So when you look into the back in here, we're assessing it if you wear more the medial side of the shoe or the outside of the shoe. Same thing if you wear more the front outside of the shoe or the inner inside of the shoe, the part in here. Those things we therapists kind of look and see what kind of pattern. So mine, you can see that it's more towards the center on the ball of the foot, and more towards the medial in here. So it seems actually lateral. It seems quite proportional and normal per se. But like I said, this is a new one. It has no wear and tear on the bottom of it. But I found that the absorption is already losing its ability, though it's newer. It's only like about 2 months newer, and this one is about 2 years old and looks pretty decent in my opinion. But how your knees and joints feel afterwards, and how your balance looks, and how it feels inside of the foot also matters, because we can have this chain effect of how much pain and forces are distributed towards your ankles, knees, and hips, even lower back, when you don't have adequate shoe. Okay, so that's one of the things you have to look for in terms of looking for the proper shoe, assessing your balance, how that balance is improved when you have a shoe that provides you just enough stability, and assessing the absorption and the wear and tears of those shoes. So if you're losing that stability, if you're getting a lot of wear, it's going to accentuate a little bit more of the bad mechanics in your foot, and it's going to have this chain effect up in your joints all the way to the lower back, and sometimes even neck, because of the changes in posture. Okay, so make sure to kind of select a good pair of shoes for you. Doesn't really matter the brand. Of course, there are some of the brands are better than others. Most of the time, you know, it's a Brooks and Saucony, but there's so many other new brands that are coming out on the market, and I think that anything that kind of it has you like it and it fits you well, it doesn't create blisters or anything like that, and give you that, you know, no stability in your shoes, on your feet, doesn't have a lot of twisting, doesn't have a lot of bending, has a good keel support, and have a good absorption, you're good to go. Okay, so in today's video you learn about how to look at shoes in a different way. Perhaps that will help you to become a little bit more savvy when you like selecting the pair of shoes for your future activities. I'm Dr. Adriana Potter. Thank you so much for watching. Don't forget to subscribe and press the bell button to receive future notifications.